Good morning, everybody. Today I want to take class on a chapter of class 9, that is vitamin B complex and minerals. Vitamin B complex is not a particular vitamin. The vitamin B1, vitamin B2, niacin, pantothenic acid, vitamin B12, or subcategorized vitamin B type vitamin have been conjugated and make that vitamin B complex. So vitamin B1 is thiamine, vitamin B2 is riboflavin, vitamin B12 is cyanocobalamin. So different questions can come out from here. That is provitamin, what is provitamin, what is antivitamin, what is pseudovitamin. So there are very few vitamin who are structural similarities with another structure, but they will not do the functions of vitamin. They are the pseudo vitamins. And if we look forward towards the functions of vitamin B complex, then we see it helps to the formations of blood cells. It prevents the loss of appetite. It helps to the proper digestions, and we know vitamin B1, deficit of vitamin B1, vitamin B2. We know the beriberi is one type of disease. So whenever that vitamin B basically prevent beriberi and Peagra also. And deficit of vitamin beriberi, stomatitis, anemia, and Peagra. And we know different types of anemia is there. That is the CKSA anemia, hypochromic anemia, normocytic anemia, megaloblastic anemia, CKSA anemia, pernicious anemia. So here basically we know if there is neither any proper absorption of vitamin B12, then a particular type of anemia is occur, which is known as pernicious anemia. And as vitamin and as niacin prevents the Peagra, so that's why it is called the Peagra preventive factor. Peagra preventive factor, and niacin is basically responsible for the generations of NAD, and riboflavin is essential for the productions of FAD. All of you have to keep remember it in your mind. And we know vitamin C, basically ascorbic acid, and we know about denticaries, basically Actobacillus mutagen, and basically it protect our teeth, and it prevents the bleeding from teeth, and RBC and platelets are formed by the help of vitamin C, and it prevents scurvy. And minerals is also essential. Minerals is very essential. On the basis of its demand, we have classified minerals into two categories. One is the major elements, and another is the minor elements. Major elements means they are basically very much essential for proper growth and nutrition of the body. Sodium, potassium, calcium, phosphorus, sulfur, manganese. Sodium, they are basically the major elements. And the minor elements are the iron, copper, zinc, boron, fluorine, iodine, manganese, cobalt. They are the minor elements. Okay, basically they are essential, but they are not so much essential just like the major elements. And that minerals plays a very crucial role, such as sodium. It helps to the nerve stimulations, the cardiac contractions, it maintains the osmotic pressures, it maintains the water balance of the aquatic animal, we know, and the massive contractions is also occurred by sodium. And calcium basically responsible for the bone formations and the teeth formations, and the muscular stimulus and the contractions is basically mediated by calcium. So we know in skeletal muscle contractions, calcium is essential. And phosphorus basically maintain the ionic balance, the enzyme formations, and the bone and teeth and muscles and blood cells are formed by the help of phosphorus. And sulfur basically responsible for the generations of insulin and heparin. So they are very important. And we know calcium, in deficit of calcium in child suffer to ricket, and osteomalacia also occurred. So minerals we feel are very pivotal role to our body, and water with ionic balance is also essential to the body. Otherwise, body will suffer a lot. Thank you. So different questions can come out. This is basically for class 9. So what is vitamin B complex? What are the chemical name of different vitamin? What is beriberi? What is PB factor? What are the diseases have occurred due to deficit of vitamin C? What is scurvy? What are the major and minor elements in our body? And what is provitamin, antivitamin, and pseudovitamin? And give examples of them. Thank you.